Do No Harm by Dr David Cartland. As an example of medical gaslighting, I was working at a practice where I saw a patient brought in at the end of the morning surgery by her mother in a wheelchair. She was peg-fed, a tube placed externally into her gut, and had dysphasia, slurred speech, and a weak left side. She worked in healthcare, so would have been coerced into taking the jab to keep her job by taking a jab that had no data to show that it stopped transmission. She took AstraZeneca as her first jab and developed a small deep vein thrombosis shortly after. This was managed with a short course of blood thinners and the vaccine was exonerated from causality. This was demonstrated by the fact that despite a likely provoked DVT from the AstraZeneca jab, she was given another AstraZeneca jab, which led to another much larger blood clot to the other leg. At this point, there had started to be some discussion about a possible correlation between clots and the AstraZeneca, eventually culminating in market withdrawal. She was then asked to get her booster. This time the vaccine centre mixing things up with a 30th birthday present of a Moderna 2 days after her big day. Within 24 hours, she had a mini stroke known as a TIA. Again, no attribution despite the temporal correlation to the jab. 1 full week after the jab, she went on to have a large right middle cerebral artery clot, aka a stroke, leading to her losing motor function on her left side. I saw her some months after this had happened for something quite unrelated that morning. I asked her what the doctors felt caused her stroke, and I remember this moment very well. She deadpan exclaimed that the events were down to clots caused by asymptomatic long COVID. I nearly fell out of my chair as the anger raged in my mind. She had been genuinely gaslit to believe this despite confirming that she had never had any symptoms of COVID, nor tested positive in her history, yet had been convincingly sold the theory that at some time in the past she must have suffered a bout of the deadly virus without ever knowing it or having a test to confirm it. Outrageously, this claim was documented in her neurological outpatient's letters and discharge summary and was coded in her GP notes as such. This story is one of many of much evidence of medical gaslighting and anti-science that I've discussed elsewhere in my diaries. I rang the senior GP on call when I had a few spare minutes before phones had closed down for the day and explained my dismay here. We had a circular conversation whereby he supported the claims of asymptomatic long COVID despite the lack of evidence, yet bizarrely used the argument that correlation doesn't equal causation that we have all heard of despite the clear temporal coincidence, he claimed, and asked me how I could prove that this was due to the jab. Welcome to my new world of medical ignorance and the first signs of prion disease in my colleagues' academic reason and critical thinking. Following our altercation, I was not invited back to work at this particular surgery.